Eliot Hall. I'm a pediatrician in Bellows Falls, Vermont. I've been practicing pediatrics for 20 years. I've been here in Bellows Falls for 17 years. My dad's a pediatrician. I've been around it my whole life. I've been through quite a generational change in documenting the medical record. The best days for me were just dictating into a tape recorder and having a note that reflected my encounter with the patient. It was conversational, it was descriptive, it was clinical, and it was exactly in my own words. The initial use of the electronic health record was ridiculous. It was really like choosing words out of a dictionary and cutting and pasting them into a patient's chart. And the computer would introduce language that did not sound like me. And I was very unhappy with the chart that resulted. So initially I started using Dragon software. And that was a partial solution that created a note that was more readable. But my IT staff and my billing staff was very unhappy that it did not create a note that was searchable or billable. So I really was looking to NoteSwift to solve those problems, and it has. I heard about NoteSwift from a partner who tried it out. And I worked with some radiologists who were showing me that they could do all of their charting electronically without using a mouse, without using a keyboard, just their voice. And I thought, why don't I have that? I see 15 to 20 patients a day in the office. Sometimes in the winter, I'll see 22 patients, but a typical day for me, I see 17 patients. When I have a steady day and there's not chaos and I'm not being called back and forth to the hospital, I can sit down after a patient encounter and in 2 minutes document that encounter. During the time prior, I essentially got none of my charts done during the day and would spend 1.5 to 2 hours at the end of the day or a subsequent day doing all the electronic charting. So NoteSwift has made real-time charting possible for me where it never was before. I found that using templates to document a patient encounter was not really reflective of how the encounter went, how the conversation went, and that my descriptions of physical findings, clinical findings were extremely inaccurate and really impersonal, and they didn't look real. I initially used Dragon as a tool to solve some of those issues, but Dragon had a lot of limitations for me. NoteSwift did what I expected an electronic health record to do from the very beginning. I expected that I would be able to template the normal findings and then enter in a useful way the positive clinical findings that reflected the encounter with the patient. NoteSwift does that, and it does that in a way that's billable and uses my own words. The specific features of NoteSwift that I find most useful are that I can enter the review of systems without clicking on any buttons. I do it entirely with my voice. I can enter the entire physical examination entirely with my voice. And I can go directly to the assessment and plan, enter a diagnosis, enter all of the medications, tests, or other treatments completely with my voice. I do have to put my hands on the computer to actually send a prescription with all the correct details. But other than that, I can leave the patient room with most of that information done. In a typical day where I'm seeing 15 to 20 patients, my charting has been reduced from 1.5 to 2 hours down to about 30 minutes of after office time. It's amazing what you can do with an extra 6 or 8 hours a week. I'm a woodworker. I'm a cyclist. I am enjoying time with my family. To have 6 hours back is just incredible. What NoteSwift had done for me that's really fantastic is that I've gone from being frustrated and unhappy both with the process of charting and with the results to a process that seems more intuitive, it's more natural, it's quicker, and it gives better results.